For more than a decade, Angela has worked with critically ill patients. In the midst of the COVID pandemic, she, along with her fellow nurse, Sarah, co-created a nursing podcast. In it, they share their personal stories about being bedside nurses. It was first geared towards fellow professionals, but it's now gathered a following of everyday people interested in their experiences.
We are nurses because we want to save lives. And we will walk in every day and do that. But it becomes harder when you know that the probable outcome is not going to be good.
Well, I mean, we've seen enough vented patients to know who's getting better and who's going to get it off and who's going to just get fibrosed.
Yeah.
And we have to do a terminal extubation at some point, and it's heartbreaking because at that point, we've already known these people for weeks before they got on the ventilator.
Right. We get to know them. They know us.
We know their family.
And
we have conversations with them. We give them pep talks.
Yeah. We tell them, you're going to get through this, you're going to get through this. And then we're making these, what feels like to me like false promises when they're like, please get me off this vent. Please get me off this vent. And you're like, we're going to do everything. And then you hear they died 2 months later.
The first wave of COVID-19 left little time for critical care nurses to prepare for what would come next. They were now on the front lines of a new global war.
Angela, why don't I start at the very beginning? What was it like being told, hey, we need you to work in the COVID unit? How do you prepare for something like that? And can you prepare mentally? What was that first day like?
Oh, wow. I'm glad you asked. That was one of the scariest days of my professional career, if not my life. We had, in the community I live in, we did have some COVID patients trickling in. And initially, we had lots and lots of volunteer nurses that were willing to go without being told this was a float. This was a option. Are you wanting to do this? Do you have, young kids at home? Do you have elderly parents at home? Because at the time, we didn't know very much about this virus, how it was transmitted, how contagious it was, what kind of PPE we necessarily needed at the time. So it was scary. People were bunking in the hospital, in the sleep rooms, getting nearby hotels, afraid to go home at night. So we did have a lot of really courageous critical care nurses that were taking that on right in the very beginning. And I was so grateful for them because, to be honest, I didn't want to go. I did not want to go. I was terrified. And one morning, I got the call, and it was an electronic voice saying, you were being floated to the COVID unit. Please bring a change of clothes. Please bring some sandals for the shower, that kind of thing. And I just sunk into my coffee and just sobbed for a half an hour. And I honestly contemplated quitting my job that day. And I had to be perked up by my husband and can't turn your back. This is it. This is a pandemic. You got to go. Put on your gear. Let's go.
And you did. You went. But early on, there were people in your profession who were becoming infected. Some died. I mean, you had to think about your own safety, your family members, all of that, and yet you got into this profession to make a difference. Obviously, I mean, it's something you care passionately about, but you have to have that internal struggle, I think.
Oh, it was a very big internal struggle. Yes, we definitely saw a lot of our fellow coworkers become infected, become very ill. Luckily, I haven't seen any of my coworkers die, but I have seen a lot of coworkers, family members die in our hospital. So we do see the gravity of what this virus could do. And putting myself on the front lines was unfortunately not, it wasn't an option. You just have to do it. And luckily where I work, we were given enough PPE to feel safe. And we were able to get the N95s, the cappers, the PAPPers, whatever we needed. And luckily, I've been working in the COVID floor since March, and I have not contracted the virus. So somehow, whatever I'm doing, PPE works, hand hygiene works, and just being very, very cautious socially.
One of the things I love about your podcast is, this pandemic, I kind of feel like there's a curtain and there are people behind the curtain like yourself who know what's going on. And the rest of us are on the other side of the curtain, and we kind of have maybe an idea, but we really don't. I mean, when you listen to your podcast, you really get a sense of you don't really have a clue of what you're facing every day. How important was it for you to kind of convey that to the listener? Because I think what's really great about your podcast is it's so raw and so real.
It's funny you mentioned that. It's interesting because initially it was intended to just kind of be a sense of camaraderie among nurses and healthcare workers, and just commiserate, share stories, laugh at the day-to-day ICU nurse life and really what goes on, business as usual for us. But what was actually very surprising was a lot of non-healthcare workers were not only tuning in, listening, but being even more engaging and reaching out with so many follow-up questions, and almost like they were shocked by what they heard, the things that we were saying, just having our conversation about what we've been doing all day. Ended up being a huge surprise to the general public as to what really goes on behind the closed doors of the ICU, especially during the pandemic. Everything has changed, and the stories have just gotten a little bit more sinister, I guess, and juicy, interesting, and scary, highly emotional, but real, like you said.
And there's humor there too. I think one of the stories you tell is about having a really rough day and saying to a colleague, do you ever feel like crying? And the colleague was like, why would I ever do that? It's a really interesting, the exchanges that go on. And yet, tell that story, because in the end, like, somebody you would never imagine really cared about how you were having a down day.
Yeah, so on the podcast, I do joke often about how I have a heart of ice and I don't cry. I haven't cried in years. And given I am a seasoned nurse, I've been doing this for almost 11 years. I have never cried so much at work in my life combined of all the times I've ever cried. So I remember that day I was sitting in the COVID unit and I had a patient that was not doing well. And it was a very unfortunate situation because this particular patient had COVID, recovered, went home, ended up having another bout that, like I always say, COVID does attack again sometimes, and he had to come back. And at this point, it didn't look like he was going to make it. So he was a survivor and then ended up coming back a week later, ultimately dying. And I just had the conversation with this man's wife when she was said, oh, so how is he? Just assuming it's just another little bout and he'll be home in another week or two. And I told her how big of a turn he had just took, and hung up the phone and just sat there like, I don't know how those words just came out of my mouth for this poor woman, because she was so surprised. She was her cheerful demeanor when she called me just to check up on her husband, she clearly had no idea of the gravity of the conversation that was just about to put on her. And so that really surprised me. Obviously, it devastated her. And the nurse that was next to me, he's a male nurse, of course, and he's got this attitude kind of thing, and he's real fun and real funny, and I really enjoy working with him. But he looked at me, and I have a face that makes a lot of expressions, so I must have had a face on, and he looked at me, he's like, are you okay? And I was like, do you ever just feel like crying? And he goes, crying? That's the last thing you want to do. And then just walked away, and that was the pep talk I got from him.
But you did have a doctor who's kind of a seasoned, grizzled guy who did ask how you were doing afterwards. So I think that was kind of the interesting payoff in the story, is just how the dynamics can shift, and people kind of pick up on each other and what they're going through, I guess.
Absolutely. We have some physicians tend to be, they tend to be a little bit different than nurses as far as personalities. Their heads are so filled with treatment, medicine, plans, dictation. There's so many things, and they have so many patients that in their heads, there's just no room for small talk during the business hours. And so when you see them walking around, they're not usually, it's almost like robotic mode. And these days, I've seen physicians that haven't had a day off since Thanksgiving, and they're looking dark and gloomy and walking the halls. And right after that nurse and I had that little conversation, one of the physicians that is usually very stern and not emotional whatsoever stopped when he saw my face, and he said, "Angela, are you okay?" And that's when I just started crying in front of him. And he, in turn, shared a very emotional story with me about a patient that he had just lost on the table, and was telling me it was all because of COVID. This is all because of COVID. She was scared to come to the hospital because of COVID. If she would have come an hour sooner, he could have saved her. And that was what was going through his head all day, is COVID is not affecting just the COVID patients. COVID is affecting everybody. So it's just, we're all going through it.
Yeah, and you talk about your nerves of steel, and yet you also talk about triggers, and that everybody's susceptible to that. Talk to us about how triggers work for people in your field.
So in the episode Triggered that you're referring to, we kind of, after listening back, Sarah and I were both talking about how the intent for the term triggered was really to have a response, like a emotional response to a patient that you can connect with on a personal level, that makes you think about either your own mortality or a family member or close friend that had this specific diagnosis and didn't do well and you lost them. And it's just something very familiar with that patient where it hinders your care. So when you're getting a report going, oh my God, my brother had this same brain tumor and my brother died from this same blah, 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 and he had the same treatment and he had the same conversations with these surgeons, and now this patient has the same thing, and then they start thinking about their brother who went through it, and now they're overwhelmed with emotions and can't continue to care for that patient. So triggered meaning I'm not okay right now to take care of this, because we are human. And so that was the intent going into that episode, was to talk about that, because I think that's an important topic to discuss with healthcare providers, because it's so common. But we ended up going, it transitioned into almost pet peeves in the hospital, because yes, we are triggered by everything that's going on, everything that's changed, and the overwhelming sense of responsibility that falls on the nurses' shoulders right now during the pandemic. All the phone calls, all the family members, and everybody needs the nurse. And the nurse needs to be with the patient. And that's what's really, really hard, is being stretched so thin, being out of ratio, having very little resources to no help. People don't want to come to the COVID floor. People are scared to come to the COVID floor to give us help. So we kind of feel a little bit left out on a limb sometimes, with a lot of responsibility, but very little resources. When I talk to the family members, especially on COVID ICU, it's never great news. And it's hard. And so and then they have these questions, and it's really difficult for me to answer these questions in a timely manner that's not going to need to be followed up by a physician.
Right.
I always say, like, this happened, the doctor's going to have to explain this further. This is going on, the doctor's going to have to explain this further. And then you know what? The doctor never talks to them.
Yeah.
So I'm having a really, really hard time taking phone calls. Finally, the other day, I was so overwhelmed. Everyone was like, fires everywhere. And the phone kept ringing, and they're like, you hear on the walkie-talkie, Angela, family member, oh, Angela, oh. And I'm like, I literally turned into Dawn Draper. I was like, listen, hold my calls. I will call everybody back at the end of my shift when I'm ready, emotionally, physically, and have the time. Right now, I'm drowning, and the last thing I want to do is get on a 20-minute conversation about something that I need to be taking care of in the moment.
Yeah.
Everything. I have 2 of my 3 patients were crumping. There was no time to talk.
Yeah.
Someone else needs to take that burden off of me. I cannot physically do it.
Right.
We had a chance to chat before we started this conversation. You're going to be back in the unit again, if I'm not mistaken, tomorrow. How do you prepare the day before? Because you know what you're going to see. And listening to your podcast, you get a sense that any nurse who's involved in this kind of environment, especially when things are really going crazy and you're rationing care, it's almost like you're swimming in quicksand. How do you prepare for that the day before?
So you don't. You don't. You know, tomorrow is tomorrow and today is today. And my life is very different when I'm home with my family, with my kids, with my husband, walking my neighborhood, playing video games, recording the podcast, doing art with my daughter. Like, my life is completely separate from when I walk through those doors. That's when I prepare the morning I wake up, then I go into nurse mode. Now I am responsible in this sense, and then my home life kind of turns off. So you really just have to compartmentalize your headspace, because you're there, you're buckling in for 12 and a half hours when you show up for work, and you're there for 3 meals, you're there the whole day. You need to really be present. And in order to have a balanced, healthy life outside of the hospital, you need to really encourage those boundaries. And I turn my phone on silent. I don't want to hear it. I don't want to hear the SOSs from the hospital. I can't. If you want to keep me going in the long term, I need to just do what I have to do, really give it all I have, and then turn it off when I leave.
So compartmentalizing like that, it obviously is critically important, but I do think about burnout, and it has to be a concern on your part. It has to be a concern in the healthcare profession. I mean, anybody who's there in that unit with you day in and day out, I mean, it has to take a toll, right?
Absolutely. Burnout is a huge, huge problem in healthcare in general. Especially ICU. They say that typical ICU nurse only stays in ICU for 5 years. So if you think about it, that's a very aggressive, quick turnaround time. It doesn't surprise me, but I feel like an ICU nurse has a passion and a calling and almost welcomes the chaos and the drama. And with this pandemic, it didn't necessarily, for me, it didn't burn me out. It almost ignited a new spark for me. Something new that we've never seen, something new that we're all just researching and coming up with our own theories and thoughts, and being part of the science behind the studies and the meds that we're giving. And they're asking us, like, hey, are you seeing any improvements from this drug, from this treatment, from these positioning, from all these things? We are part of what is driving the care of COVID, and it has excited me in that way. So I don't feel burned out. If anything, I was more burnt out before. Now we have more of a purpose, more of a calling, and all eyes are on us. So there's never a more important time in history to be a nurse. I have always been proud of what I do, and now even more. And to be on the front lines of it, seeing it, witnessing it, and being so up to speed on everything, I feel privileged.
I think about you talking about buckling in for 12 and a half hours. It's not a lot of boredom. It sounds to me like it's more the sheer terror of 12 and a half hours. Talk to me about the long-term mental piece of this, because obviously it has to take a toll.
Oh, absolutely. I am extremely concerned for what is going to happen to the healthcare workers, specifically nurses and intensivist physicians on the front lines, seeing this so aggressively. 1-2 years from now, what's going to happen? I can predict, if not happening already, drastic increase in PTSD symptoms to be showing up, because the amount of trauma that we see every single shift, especially in the last surge. So the last surge in Los Angeles has been the worst that we've seen. And we went from 1 to 2 dead patients from COVID maybe a week. Now we're seeing 1 to 2 every day. And the problem with COVID is they come in sometimes just requiring a little bit of oxygen. And it's not, the patients that are old and sick and are kind of nearing death. It is people that are in the middle of a full life. And when we connect to those patients, we talk to them. There is no family members visiting. There is no one else. It's us. So we're the ones talking to the family, connecting to the family, encouraging the family. We're the ones making relationships with the patients, putting up their pictures of their grandbabies that they drew, and putting up the framed photos of the family members in the room. And we're making these heartfelt connections, friendships, relationships, only to watch them get worse and worse over the next week, 2 weeks, months. And then we watch them die and we mourn. We mourn with them and the family. And I don't know how we can process these traumas because there's not enough time in between the next one to even know what hit you. The next patient's dead. The next one is suffering. The next family member is this. And you go home going, what just happened to me? And I mean, I personally would benefit from probably seeing someone, talking to someone. That's my plan in the future when there's more time. But for now, I just am in the thick of it, going through the motions. And I do anticipate a lot of mental issues, I guess, in my future.